All right. Hello, my name is Maria, and our presentation is going to be on typhoid fever. We are going to be presenting a list of problems and solutions to reduce the presence of typhoid fever in Nigeria through improved sanitation and hygiene means. All right. Typhoid fever is an infectious disease caused by a bacterium known as Salmonella typhi. Common symptoms of the disease include weakness, loss of appetite, diarrhea and constipation, a headache, and abdominal pain. A diagnosis can be obtained through a simple blood culture. And the most common course of treatment is IV antibiotics. And without prompt treatment and recognition of this disease, it has proven to be very fatal.
Hi, I'm Sonia Goyle, and I'm a rising junior at Lake Park High School in Chicago, Illinois.
Hi, I'm Jade Compton, a rising junior at Laurel Springs School in Colorado.
Hi, I'm Nor Maria Bouzid, and I'm a rising senior at Falls Church High School in Virginia.
Hi, I'm Olivia D'Souza, and I'm a rising senior at Bishop Kelly in Boise, Idaho.
Hi, my name is Goldis Freeble, and I am a rising junior at Elizabeth Seton High School.
All right, so the problem we are focusing on is typhoid fever, specifically due to poor sanitation practices. Every year, typhoid fever infects 21.6 million people and can kill anywhere from 216 to 600,000 people. Typhoid is a problem in Africa as a whole, but we are focusing specifically on Bauchi State, Nigeria. One of the main factors is poor sanitation, and there is a vaccine, but it's not widely available. Some strengths of the current system are that, first, the government tries to provide clean water and other assistance. Second, a vaccine does exist. Third, in most cases, the government mandates that during a few hours each week, families must sanitize their environment. These are known as Sanitation Saturdays. Finally, the police aid the sanitation efforts by monitoring during the designated times. However, there are a few weaknesses. First off, only 5% of the Nigerian government's budget goes towards healthcare. This means that sanitation efforts are often underfunded, and while there is a vaccine, it isn't promoted or widely accessible. But we have a unique opportunity right now. Due to the current pandemic, public health is in the spotlight. Therefore, we have a special chance to build on this momentum and bring awareness to typhoid and proper sanitation practices in general. Finally, there are a few threats to consider. First, there is suspicion regarding Western medicine, which makes it difficult to promote the vaccine and healthy usage of antibiotics. Secondly, a low education level and socioeconomic status make it difficult to promote healthcare initiatives in general. For our solution, we had 4 core concerns that we addressed with 4 objectives. Our solution involves creating informational pamphlets and posters that focus on our objectives. Our first concern was a lack of education. We are attempting to fix this by starting the educational process with the children, specifically in schools. Our second concern was poor sanitation. We are choosing to address this by highlighting improved sanitation practices. Our third concern was contact spread, since typhoid can be incredibly contagious. Our goal is to slow down the spread by increasing awareness. Finally, our fourth concern was the prevalent distrust of Western medicine. Our goal is to educate the community and encourage proper antibiotic usage.
Okay, so our plan is to target kids from 5 to 17 years of age because they are more vulnerable and they are still attending school. So our plan is to make these posters that you can see in the bottom right-hand corner of the screen and have them hung in common areas where the students go to wash their hands. Also, we're going to provide pamphlets for students to take home to their families to learn about symptoms and when to see a doctor, but there's also going to be coloring involved to engage the students.
Upon contacting Dr. Muhammad Umar, we were made aware that children are provided with crayons in their school setting. This will facilitate the coloring of the pamphlets. As they color the diagrams, they will interact with the information and process it more efficiently and effectively.
So this is our pamphlet for students to take home to their family. The front side of the pamphlet is located on the left side, while the back side of the pamphlet is located on the right. The coloring section for students start on the right side, number 1 and number 2, and then transition to the left side, number 3 and number 4. Students also have the opportunity to color the microorganism bacteria underneath the big title, typhoid fever. Moving right along, on the right side, we provided for students and families symptoms of the typhoid fever, and if they are experiencing any of these symptoms, they must go to the doctor. On the left side of the symptoms, we prepared a procedure on how to wash your hands, since typhoid fever can be prevented by practicing good hygiene. Lastly, on the far left side, we gave a brief description of the typhoid fever, how it travels, and its diagnosis.
There are many advantages to our plan, one being that it targets a variety of people. The campaign targets the kids, their families, and their school environments because of how interactive it is. In addition, our campaign will be widely available in Bauchi State because of the numerous schools and students that are there. And it will also be cost-effective because the only great expense is to print the posters and pamphlets. So next, even though there are many advantages, there are some obstacles we may come across along the way. For example, it may be difficult to persuade kids if they aren't willing to understand the importance of typhoid and the situation at hand. Also, pamphlets might be misplaced because kids and their families might leave it somewhere, and pamphlets are small items that can be lost on accident. And the solution effectiveness might depend on the literacy rate as well, since there are multiple languages spoken in Bauchi.
For our funding, we are requesting $200 to execute our campaign. And most of our $200 would go towards printing the informational posters and pamphlets, while the rest of our budget would allow for our distribution throughout the schools in Bauchi State.
Thank you. And if you have any questions and concerns, please feel free to contact us.
Okay. Fantastic work, guys. I'm going to bring in our judges to speak about your programs. Give me 1 second. Running to panelist. Running to panelist. Okay. Dr. Garba is here. Nancy Allen is here. All right. So, guys, Dr. Garba has been working on public health campaigns throughout Nigeria for many years. She has saved thousands of lives in the nation that you are working with your public health campaign, and she is here to give you her thoughts on your presentation. Dr. Garba, please tell us what you think.
Thank you very much for this wonderful presentation. Everything was okay. The body language, the diagrams to color for the small children to color, and other than that, I think everything was well written, understandable, and it was perfect. It was amazing. Thank you.
Perfect. And sorry. Thank you, Dr. Garba. I really appreciate your thoughts. And now we have Nancy Allen from the National Consortium for Health Science Education. They basically train and create state leaders at the national level in the U.S. territories. So as we advance education in health science, it's Nancy who's leading the way, and she's here to give you her thoughts. Nancy, you're on.
Sorry, I'm unmuted. Because I do work with programs in high schools across the nation, I really liked your intro because I like knowing where you were from and the high schools, and whether you were a junior or senior, and your state and your city. So thank you for including that. That was meaningful to me. I liked your SWOT, especially that slide where you did the strengths and the weaknesses and the opportunities and the threats. Your solution slide was very engaging. Just one I might mention, and it may just be because it was on the PowerPoint, but I think it was your pamphlet. It was over on the left. The white on the light blue made it a little difficult, I thought, for the font to be read. So you might want to think about that. Just revisiting that before those were printed. I thought your the 101, hand washing 101, the way you had graphics and really took them through the steps of washing their hands with the photos, I thought that was very good. You sort of brushed through your reference slide there, but I thought that was good that you included it, but you didn't stay on it very long. I don't know whether you thought you were close to your 10 minutes, but great job. Your presentation skills were spot on, and you did very proud of your work.
Guys.
Oh, remind me the name of the team.
Graze A.
Okay, I see it.
Guys, fantastic presentation. You guys really melded well together as a team. Not every team can play off each other and really divide up the time and make sure you guys all equally stand out. But I think you guys took the time to do it and create a presentation that wasn't just about you guys as individuals, but about your goal as a whole. And so you taught us, not just focus on what you're saying, but what you're trying to accomplish. And that really, really came through with your presentation here. So I can't thank you enough for taking the time to do this. College admissions officers, contact information for every one of these students will be at the very bottom of this YouTube video, links to their individual websites. You can also see them diagnosing a patient in northern Nigeria in Bauchi State to save a life on their personal websites. If you have any questions about them, our contact number is also at the bottom of the YouTube video. Please feel free to reach out to us. We are honored to talk about what they accomplished these past 2 weeks.